I'm going to discuss about new tuberculosis treatment regimen that has recently been implemented in Nepal according to annual report 2074-2075. In this regimen, as compared to the previous one, second category, that is category 2, is taken out, has been taken out, and there are mainly two groups in this new regimen. First one is new TB cases, and second one is all the retreatment cases. And in new TB cases also there are two subclass. One is simple form, and another one is severe cases. In severe cases, by severe cases we mean tuberculosis including CNS, musculoskeletal TB. So now, so let's begin. So in the new TB cases, that includes both child as well as adult, and that are bacteriological and or clinical diagnostic cases, that may be pulmonary or extrapulmonary cases. We have the same full duration for treatment. That is, in intensive phase we give the first line 4 important drugs that they are at surgery for the 2 months, and in continuation phase we give the first 2 drugs at CNR for 4 months. And in the severe cases of new TB, the intensive phase is similar, but in continuation phase we include ethambutol as well, and they are to be taken for 7 months, and with the possibility of 3 more extra months for this drug in the end according to the sputum test. And for all the retreatment cases we do a new test, that is CBNAT test, that is cartridge based nucleic acid amplification test, or export mycobacterium tuberculosis, or resistant to rifampicin test. This test detects the bacilli and resistance, whether the bacilli are resistant to rifampicin or not, and the result is within, then we get result within 2 hours. So, and this test detects whether the bacteria are resistant to rifampicin or not, and this test is to be followed by LPA, that is line probe acid test. This detects whether the bacilli are resistant to isoniazid or not. So the most important thing is that among the anti-tuberculosis drug, the first drug that undergoes resistance is isoniazid. So before the bacteria to be before the bacteria are resistant to rifampicin, they could be they get resistant to isoniazid first. So LPA is a very important test that has to be done in case patient are in case the bacilli are rifampicin sensitive. So by these tests, that is export MTP or IF as well as LPA test, we get the following things, and according to their status we have different treatments. So if the bacilli are sensitive to rifampicin and also sensitive to isoniazid, we have the same treatment regimen, that is for 2 months we give HRGD, and for the 4 months we give HCNR only. But if the bacilli are resistant to isoniazid, then we give HRGD for 6 months, and we include levofloxacin also, the full duration. We are not giving streptomycin in this new regimen. This is the important point, we are not giving streptomycin. And in the next subclass, bacilli are sensitive to rifampicin, but this LPA is not done because of no access to LPA. In that case also we continue at our JD drop for 6 months, but we are not giving levofloxacin. And the important thing is all the patients with TB meningitis and TB pericarditis, they have to take steroids in addition to TB drugs. And the important thing is NTP, National Tuberculosis Program, no longer recommends category 2, which includes streptomycin, to be used. And officially, category 2 has been taken up. So now we are going to discuss about multi-drug resistant TB regimen. So here are the list of few drugs that are used, that are taken, and abbreviations and the short form of these drugs are given here. So uh, NTP has also implemented a new regimen for multi-drug resistant treatment, that is shorter MDR treatment regimen. But the conventional longer regimen has not been taken out. It is also there. So among these two, one has to be followed, whether we go for longer conventional regimen or we go for shorter treatment regimen. So first we will talk about conventional multi-drug TB treatment. So in first phase is for 6 months, and continuation phase is for 12 months. We take in the first initiative phase, we take two first line drug, that are Z and E, and in second line drug we take coke. I remember like this. The first letter of the name, that is CS, means cycloserine or ofloxacin. In this ofloxacin, we can either give mofloxacin or levofloxacin, and third one is kanamycin, and fourth one is ethionamide, ETO. And in the continuation phase for 12 months, we are taking only pyrazinamide for the continuation phase. And in the second from among the second line drug, we take 3 drugs except kanamycin. Important thing is that kanamycin is not taken for longer duration of treatment. Kanamycin is not taken for, if the treatment is taken for long period, kanamycin is not included here. So important thing is that in India, instead of pyrazinamide, ethambutol is continued for 12 months. But in Nepal, we are taking pyrazinamide because ethambutol is ototoxic drug. And in the shorter MDR treatment regimen, that is STR, this is a new regimen according to NTP, new regimen by NTP. So for the first 4 to 6 months, we are taking same Z and E, and from the second line drug we are taking same as conventional except one. We are changing clofazimine. We are not taking cyclosporine. In place of cyclosporine, we are taking clofazimine. And for the continuous phase, for the 5 months, we are taking both pyrazinamide as well as ethambutol. Since we are using ethambutol, we are decreasing the duration. We decrease from the 12 month from 12 months to 5 months. And from the second line drug, we are taking 2, clofazimine and ofloxacin. Ofloxacin can be levo or mofloxacin. We are not taking kanamycin as well as ethionamide. And the important thing is that kanamycin is not to be included on longer regimens. And there's one new class drug, there is bedaquiline. This is a drug specifically targeting mycobacterial ATP synthetase, and it is to be given for 6 months in pre-XDR, means extended drug resistance or extended drug resistant treatment regimen. Thank you.